Ooh, Nelly.
So there's something.
Oh yeah.
There is something.
What took you so long?
We are struggling.
I've
got so many. I'm trying to keep it professional for you. This is hard for me right now.
You're doing that. You're doing the head into my hands.
Ooh,
that was a much.
That was something.
Yeah.
So that feels so nice when you do that. Like that towel pull I was telling you about.
Yeah, unfortunately, that stuff's not exactly quote unquote legal in Ontario.
Well, if you don't say anything, I won't say anything either.
Oh, well, let's just keep it between you, me, and the thousands of subscribers. Why don't we? Eric, good to finally have you in here. It's been, about a year and a half at this point?
It's been a long time.
It's been a minute. So Eric and I have known each other for a while now, but he's finally coming in regarding some pain he's having in his upper back, neck, as well as symptoms down an arm when he's doing any kind of overhead lifting at home. So Eric, why don't you kind of tell us about that?
Well, as you can see with my physique, I do lift a lot. I'm very into fitness, as you can tell.
Yeah.
And I'm sure your viewers will agree with me. But when I'm doing this, my right arm feels different than my left. So I feel like there's maybe a bit of a issue there.
Okay, so your right arm feels different from your left when you are doing that overhead.
There's a bit of a numbness on my right compared to my left.
All right. So you use the term numb. Do you feel cold at all in that arm, or is it strictly kind of like a numb tingling feeling?
It's just a coldness.
Coldness.
Sorry, it's just like a numbness, I think.
Okay.
And it's not a numbness, it's just more of a feeling. It's a different feeling for some reason.
All right. So anytime we're dealing with numbness, we're looking at either a vascular or a neurogenic cause. All right. So as Eric's describing, when he presses upward, we have a lot that's moving in the shoulder. We got the clavicle, we got the pec, we got not so much the scalenes, but those are two common impingement sites of what we've referred to as thoracic outlet syndrome beforehand. So we're going to be screening for that, and that can be either vascular or neurogenic in nature, which we can't really determine in here, but we can with some additional diagnostic tests done outside the clinic. So that's kind of just where my head goes right off the bat. Not saying that's the case. We'll do an exam. We'll figure it out.
Quite serious.
So I know that it sounds serious. Anytime you hear the term syndrome, it really sounds that way. The common cold is a syndrome. It just means a collection of symptoms. So don't be concerned of me saying that. Very common. I see it every day, and it usually responds pretty well to what we do in here. You also said you have neck and upper back stiffness going on too?
Yeah, like my posture is kind of off, and I'm in front of a computer all day. Okay. And I always find myself, like, I'm always massaging my neck area.
Yeah, okay. So
I'm always massaging this,
I know what you do, but just for the people watching, like, what do you do for work?
So I own an insurance business, and we do, car, home, commercial insurance, and we're just basically at the computers all day, or we're having client appointments all day.
And so that's like textbook desk office job then, right? Like long time spent in front of the computer, right?
And then there's also the occasional drive to McDonald's, or to Orange just to get
that
lunch.
Mixes up the sitting position at least, which is good.
Yeah.
And that's not even a joke. Mixing up your sitting position can benefit this greatly, especially if you have a good ergonomic setup. I haven't seen the inside of your office. If you're in it all the time, I'd hope you have a good ergonomic setup. That's something that we can explore in the future. If you like, I can come visit and give you a breakdown.
I would love it. Really
awesome. Let's do that someday. Okay. So what we're going to do today, are any other complaints, or is that really your primary, like that right arm, kind of neck, upper back tightness?
Yeah, just like I know that I'm kind of tight up here, and I haven't been to a chiropractor in many years.
Yeah, okay.
So,
how long? Like 5?
I'll say 8.
8 years? About? Okay, so long time. So Eric was mentioning that he's getting some neck pain as well as pain down into the upper traps region here, and symptomatology into the right arm when he's doing that overhead press. So the first thing we're going to do, pretty standard, is going to be the C-spine range of motion exam. So Eric, I'm going to start by just getting you to bring your chin down to your chest for me. Now in doing that movement, do you get any provocation of anything down the arm at all? Anything down the upper back?
Well, your first mistake is thinking that I understand what provocation means.
Any exacerbation?
Pardon me.
Any worsening, or does that symptom arise down the arm at all?
No, it's fine, but I'm just maybe there's something wrong with my right arm. Maybe something's wrong with my left arm. Like, you never know.
I mean, if you're getting the numbness with the overhead pressing on the right side, that means I'm going to examine the right side.
Okay.
Right? If I go ahead and push your head further, does that cause any discomfort at all going on back here?
No.
Not really? Good. Look up towards the ceiling for me, please. How about that?
No.
No. Awesome. Still okay?
You're getting a little bit a little much there.
A little pinchy there?
Yeah.
Okay. Forward. Get you to rotate your head as far as you can to the right, please. We can get to about 45, 50 degrees. Go as far as you can to the left. We can get to about 50 degrees. Good, so we're equal both sides. Bring the right ear down to the right shoulder. So sorry, we're gonna actually tilt the head just like the face forward, just like that. Good. All right, 45, left ear to left shoulder.
That's a little bit more pressure.
Just a little less on that side, yeah. Okay, so I'm gonna get you to give yourself a tight, tight hug. You probably earned it, tight hug. And I get you to rotate as far as you can to the left. We can get to about 50, 60 degrees. That's really good. Now as far as you can to the right. Nice, good. Okay, so to check for what I mentioned beforehand, that thoracic outlet syndrome, we need to do Adson's, Edens, and Wright's test, or the ones that we suspect the most to be relevant, and also all the involved musculature. So again, beforehand I talked about the scalenes. I'll put a diagram on them up now. Those are the muscles that connect to the side of the neck and down into the first rib. We need to check underneath the clavicle and the subclavius muscle. Again, we'll put a diagram of that one right up there as well. And then finally, in addition to those two, we will need to check the pec minor itself. Diagram of the pec minor. So, editor, you got your work cut out for this one. So first things first, Eric, I'm going to take this arm here. I'm going to find your pulse. Pulse is... Got it. Okay. I'm going to get you to take a big breath in for me. Hold it. And then I want you to look down and to the right and hold your breath as you do this. Don't let go. Now, if you, of course, absolutely have to breathe, you can breathe, but we're going to try to hold this for 30 seconds, okay? So the reason I'm holding his pulse here is because I'm checking to see if we get any decrease in vascularity with this, which would be one explanation for that numbness. His pulse is still going strong, so I don't think that it would necessarily be due to the scalenes. That's what this one tests. You can breathe again. All right, and we're gonna come back here. You still with me?
I'm still with you.
You can go ahead and look down for me, and just keep you right there.
Do you want me to breathe in? Or
Yeah, you can just breathe normally.
I can breathe?
Yeah,
okay.
Yeah, you got it. So are you getting any kind of recreation of tingling or anything into this arm with that movement?
It's a little uncomfortable.
A little uncomfortable. Okay.
Right now I'm just wondering if the camera does add 10 pounds or not. That's what's going through my head right now.
Yeah, I believe that it does. I really need
You
to
think
upgrade.
it does?
I need to upgrade to the
Man.
latest iPhone. I really do.
Put that little filter on there or something.
We're getting a little bit of a decrease in Eric's pulse rate here. So, not pulse rate, but pulse strength. So it could potentially be due to the clavicle
And there is
area.
something
You're getting
happening
something
here.
going on in there too. Okay, so that's a pretty good sign. And then lastly, we're going to come back up this way.
Well, I don't want to get no syndrome.
No, honestly,
You keep on saying syndrome.
The issue with a lot of medical lingo is that it sounds so scary. It's really not. It's just a way to classify things.
And I'm definitely feeling something here.
Definitely feeling pinching with that one. Okay. So, two possible sites. We're looking at the clavicle. We're looking at the pec minor. Doesn't really matter where it's coming from. We're going to treat all of them anyways. The good news is that if this is in fact TOS, we can clean it up very, very easily. It responds very, very well to what we do in here, so I understand that you're stressed. Apologies for that. You don't need to be. You're literally in the right place to have this taken care of, okay?
I'm in good hands.
You are in literal good hands. Yes, that's the case. All right, Eric, my hands are going to go on your back now, okay?
I give you consent.
Oh, thank you. I get all my patients to sign before the videos really start, but I still appreciate having it said on camera, so thank you. So first thing we're going to do is feel on through Eric's upper. Well, I guess this technically isn't the first thing. We've already done some orthopedic exams. But as we get up higher, do you kind of feel that huge knot right there? Let's compare that to the left side.
Yeah, that's a bit better.
It's there too, but it's not nearly as bad. It's definitely more prominent on Eric's right. Now, that area, that is the insertion of the levator scap muscle. We'll throw a diagram up in this region here. That's responsible for really bringing our shoulder blade upward. I'll show it on this side so you guys can see. Bringing our shoulder blade upward like that. Very commonly pain generator for people who do sit for way too long, specifically doing computer work and typing. So we see that literally every single day. Not something to be overly concerned about, and we can definitely do things to address it. Let's work in through here. Good. Okay, and yeah, it's there too, but it's not nearly as bad.
Doesn't feel as bad.
No, okay. All right, if we can get any movement in at the base there to start. So what I'm going to do, I'm going to get you just to keep your face right there, okay? I'm going to turn your head, but you just let me move you here. There we go. Good job. Let's keep it right there. You need to take a big breath in and all the way out as fast as you can. Good. Freebie.
So how you find it so far?
Nothing alarming. Seems pretty standard.
Do you see a lot of stress on the arm or in the back, or is
mostly up through here, okay? Like, I mean, it's kind of exactly where you are feeling it, especially in those levator scaps. But given your history and like what you do, I'm not too concerned. It all makes pretty simple sense. Nothing's moving there, but that's okay. We will check it again another day.
So is it pretty kind of stiff, or?
Yes. like they are. That's the answer. Oh, there we go. All right, let's get you on your back. So feeling through Eric's neck, we got quite a bit of tension actually right at the top.
Yeah, that's where I feel the tension.
That's tender for you.
That is tender. Ooh, kidoki.
Mistakes. All right, we're gonna keep going.
But it also feels good too at the same time.
It's a good pain, right? Which is the weirdest concept the more that I think about it. Good and pain, but better than bad pain, I suppose.
Yeah, like it does. I'm getting some relief when you're doing that.
Really?
Yeah.
That's good.
Like that actually feels good.
I hope so. Most of what I do in here feels good after the fact, not during. It's usually after. You were gonna say something more. Yeah,
I've got so much. I'm trying to keep it profestional for you. Yeah, like this is hard for me right now.
You're doing fantastic.
Oh jeez, I got it. Like, oh, I really hope that this video is worth it for you because I really could have said a lot.
Hey, when they slip out, don't worry, my editor can cut them out. So. All right, so we'll adjust starting right at the top there, okay, because I can definitely tell that you need it. Now the trick is to do this while keeping my arms out of the camera, so just drop the head into my hands.
Okay.
There you go. That was simple enough. And we're going to try again, but lower it down this time around. Good. No. All right, that's fine. Let's check out the left side. Now I'm curious. I want to hear these smart-ass comments. Huh.
Well, I'm not.
You've goaded me now. Now I want to know.
No, it's just like lots of that's what she said things going on.
Oh, that's totally acceptable.
Yeah.
Everything PG-13 is fine, and believe me, that's what she said is strictly PG-13 in today's day and age.
That feels good. It hurts a little bit more than before, for sure.
Let's handle it.
But I know that it needs to be like massaged.
When was the last time you must have good insurance benefits considering you're an insurance broker.
Dude, you don't have no idea how much money I spend, and I don't even use. Like, I haven't been to the chiropractor in years. I haven't been to the dentist since 2019.
Oh my God, you got to go to the dentist.
I haven't been to the dentist. I haven't.
Peter is rolling right now in his chair. Yeah.
Yeah.
Go see someone. All right, good stuff. Drop the head. Rotate as far as you can to the right.
To the right.
Yep,
okay.
good. Drop that head.
Ooh,
that was a much.
That was something.
Yeah, for sure.
Okay. So that feels so nice when you do that. whatever you do, like that's like that pull.
Yeah.
Like that towel pull I was telling you about.
Yeah, so Eric had seen a chiropractor previous who would wrap a towel around his head and kind of just gently pulling him like this. We're not talking about like a ring dinger type move that you've probably seen elsewhere on YouTube.
But I wouldn't say no to that either.
Yeah, unfortunately, that stuff's not exactly quote unquote legal in Ontario, so that won't be happening up in the magical land of Canada. Most of my subscribers are from the States. Yeah.
Well, if you don't say anything, I won't say anything either.
Oh, well, let's just keep it between you, me, and the thousands of subscribers, why don't we? Oh my god.
Yeah, you're having some regrets right now, aren't you?
Just a lot. Yeah, just a lot. Okay. So as we found when we were doing Edens and Wright's test earlier, we possibly have some subclavius involvement. And again, I'll put a picture up right there. Oh, camera's hard, right there. As well as pec minor involvement. So to really try to release those muscles, here's what we're going to do. Eric, I'm going to get you to start just by turning your head and facing the wall over there. Away from me. Good. All right. Now, what I'm going to get you to do is take a big breath in for me. And as you inhale and exhale, I'm going to press in right in that region there. Okay? Probably a little bit tender. And I get you to inhale one more time. And once again, exhale. I'm going to press in further. And we're right on top of that subclavius muscle. So now that I'm on that, I'm going to get you to take 10 big breaths in and all the way out just as you had been, okay? And as he does that, I'm going to almost do like a scooping motion with my thumb to try to almost lift that clavicle up off the front rib cage there. Now, of course, it's not actually going anywhere. It's not going to be lifted up, but this is a great way to try to stretch out. You can just go ahead and keep taking the breaths, okay? To just stretch out that subclavius. Also, Eric, I am very bad at counting, so I hope you're counting.
I'm at 9.
Okay, take one more, and let me know when that one's done.
That actually feels good though.
I hope so, yeah.
Like it doesn't, sometimes you feel like that pain or that tension, but it doesn't feel that bad.
Good, happy to hear. Okay, good. So that's for the subclavius. For the pec minor, we're going to take this, I'm going to get you to just keep this arm like jelly, okay? I'm going to take my hand, and we're going to press in right here. Again, that's where the pec minor comes in to connect into, I believe it's the acromion that it connects into. And as I take a contact, I'm going to sink the elbow down low to stretch out against that. So you guys on the channel would have seen me do a lot of MRT for the upper traps and the left scap. This is the same concept where we are shortening a muscle, such as the pec minor. Again, the pec is meant for pressing, right, which is the movement that he's having trouble with. Pinning it with my thumb, and then stretching it against that pin, which we do when we retract the shoulder blade, when we bring the arm backward. And again, I suck at counting. I think that was 5.
I'm not counting.
That's okay. We're going to do 5 more.
I'm just thinking about your hands. How do you keep your hands so strong?
Like,
what does that look like for you?
Well, I grew up playing a Game Boy before I knew how to read, so that was definitely beneficial. I've been strengthening the thumb since then. But don't get me wrong, when I started, my hands were sore after every single day. But since then, I mean, like now they're fine. Oh, now I know a lot of chiros are like rock climbers, and they are actually they are some sort of combat like karate. They got some crazy ass grip. But yeah, it's an acquired skill, so to speak. I think I did 7. I can't count. Yeah.
That was more than 10.
Was it? Probably. Yeah, that's my guess as well.
What's that? It felt good.
Good. We just finished doing the MRT of the subclavius as well as the pec minor, which are the 2 most likely areas that are having an effect on this kind of symptomatology down the arm there. But we're also going to work up in here because we still got a lot of tension in those left scaps and upper traps. So Eric, I'm going to start you up by getting you to look up and to the right. Good. And we're going to use those pointy elbows that I know you've heard of before. I'm going to put them right there and get you to slowly look down and to the left. Go ahead. Yeah, you got it. You are one of the very few people who actually did that correctly on their first go. Wow. Genuinely, I'm impressed.
Well,
up into the right place.
I'm going to take that as a compliment.
Down to left.
That's a compliment.
It is a compliment, yes. Up to right. Down to left.
Ooh.
There's a thing.
There's something.
Yeah. Up to right. Down to left. Good. Face forward. tilt right ear to right shoulder, please. So we're gonna, just like we did before. There we go. We had a little oopsie. That's okay. Tilt like that. Good. Take the elbow, put it right there.
And what am I doing? Sorry, now?
You're gonna now tilt your left ear to your left shoulder.
I'm tilting my left ear to my left shoulder.
Yeah, you got it.
The tilt is not the best.
Left to left. Ooh. Right to right. Left to left. Ooh, Nelly.
So there's something.
Oh yeah.
There is something.
What took you so long?
We are struggling.
Just a little last one for this side. Good stuff. Nice. All right, let's do that on this side. I need you to look up and to the left and down and to the right. Whoa! Yeah. Up to left, down to right. Up to the left, down to right. Up to left, down to right. One more, up to left, down to right.
Yeah, definitely something.
Ooh, just a lot. Face forward.
Yeah.
Tilt your left ear to your left shoulder, please.
Tilt my left ear to my left shoulder.
You got it. See, you just need one warm up round. And now right ear to right shoulder.
Ooh, this is feeling a little bit more.
Left to left. Right to right. Left to left. Right to right.
Gosh.
A little slower, okay? I know it hurts, and
You're
trying
gonna
to rush
have
to get it
to
done.
hit me up for dinner after this.
Ah,
Oh gosh.
Gladly, where do you want to go? Harper's Landing?
Keg.
Keg.
I need a steak.
Look, keg. I happen to have a coupon,
Ooh.
so we're okay.
Okay.
Or a gift card, whatever it's called. Good.
Jeez.
Awesome. All right. Shrug the shoulders up for me. Bring them up. Slowly lower. Now I'll just shake them up. Up, into my hands.
I'm bringing my
lower.
shoulder.
Yep, and slowly lower. Good, and up, and slowly lower. Good. Okay, we'll put a pin in it there. All right, so unfortunately, due to battery life limitations, we couldn't film the scraping today, but we just finished with that, and Eric's feeling a little bit sleepy. We just missed a big
Yeah,
yawn.
it was a good time.
But,
good old time.
how are you feeling, Eric,
You know
right
what?
now?
My back is feeling a lot more relaxed. Definitely is sleepy. I appreciate the fact that you're driving me home now.
Oh yeah,
you're taking me for dinner.
Yeah, the keg. We're going to the keg.
Yeah.
Absolutely. CCO, I hope you're not watching this.
Yeah.
Okay.
Really happy with that.
Yeah, so overall, you've seen chiros that were fairly comprehensive before. You were describing to me like a lot of hot compress. You've seen chiros that were pretty quick with what they were doing as well. So where would you say that I kind of fit on that scale?
Yeah, honestly, it was more similar to my first experience, where it was a bit more comprehensive, but I think that it was a really good experience for me.
Thank you.
And I definitely feel a lot of relief here, which I knew I needed to come in for. Like that was definite.
Rest assured, I know you questioned a couple times off camera, like syndrome, is that like serious? And like I don't want you to be stressed about this. I see 3 or 4 cases of this a month. It's not a big deal, and it's something that responds really, really well. So A, it's not going to get worse, and B, we're going to take care of it, okay? I want to like reassure you of that. Don't stress with that, okay? Do you have any other questions for me before we sign off for today, or? Go ahead. Yeah, the editor can take it out if it's inappropriate.
No, I'm just. No, I'll save it for another time. Everything is really nice.
All right. Well, I appreciate you coming in today, Eric. Thank you so much. Have yourself a good rest of your evening.
Yeah, thanks. Don't forget to visit Eric Rusick Insurance.
That's important as well.
And Adam Solis.
Thank you. And also
like and subscribe.
Thank you.